Welcome to the Slop Temple. We pray this video helps.
You start by deciding whether you will take vitamin E orally or use it topically. This choice dictates dose and technique. Inspect the capsule for integrity and the label for IU or milligrams. Once decided, wash your hands and prepare a clean workspace. Open the capsule with scissors or a sterile pin, puncturing away from your face. Make sure to verify interactions with any drugs you take, because vitamin E can affect blood thinners and other medications. Now administer the vitamin E in the way you selected. If taking orally, swallow the capsule with a meal that contains fat. This increases absorption. Do not crush unless instructed. Once done, if using topically, warm the oil between your fingers and massage onto damp skin in gentle circular motions for 1 to 2 minutes so it penetrates. Make sure to track how many capsules you use to stay within recommended daily limits, and adjust timing to avoid taking it on an empty stomach. To finish, blot any excess oil and store remaining capsules in a cool, dark cabinet to preserve potency. Once done, monitor the treated skin for redness or rash. If irritation happens, stop application and rinse the area with water, and consult a provider before reattempting. Make sure to watch for systemic warning signs like unusual bleeding or persistent nausea, which could indicate excessive intake. If those occur, seek medical advice promptly.
Thanks for watching. Consider subscribing if we helped you.